As we go through our workday, we touch a lot of surfaces, some of which might be contaminated. Millions of workers every day are at risk from contaminations called blood-borne pathogens. Blood-borne pathogens are present in infected human blood and certain other bodily fluids, and some of them carry potentially fatal diseases. No matter what kind of work you do, you should always be aware of the risk of exposure to blood-borne pathogens, because when you know the risk, you can take precautions. You can be exposed to a blood-borne pathogen by touching an infected person or their secretions, or you can be exposed by touching something that has been contaminated by an infected person. So how do you protect yourself? You have to understand that something can be contaminated and the infected organism may not be visible. For example, linens, tabletops, washrooms, door handles, anything that may have been used or touched by someone else can spread a dangerous germ or virus. When you come into contact with an infected surface, the organism can transfer to you. Once it is on your body, any body opening can allow this pathogen to enter your system. This includes your nose, mouth, eyes, other body openings, any mucous membranes, and any cuts, abrasions, or any other breaks in the skin. For example, if an infected person coughs or sneezes on a table which is not cleaned after use, and then you touch the table with your hands, the infection may now be on your hands. If you rub your eyes or eat anything, the infection can pass into your system. This can be prevented by following simple guidelines that will protect you from exposure. You don't know if someone with a contagious disease has touched a surface, so good hand washing is the first and most effective method to prevent spreading infections. Always treat blood, body fluids, broken skin, and mucous membranes as if they were infected, and use proper gloves before cleaning anything that may have been exposed. Wash your hands before putting on gloves and immediately after removing them. If soap and water is not available, you can use a waterless hand sanitizer. Never touch clean objects with contaminated gloves, and avoid touching your face, eyes, nose, or mouth until after you have washed your hands. Protect yourself from blood-borne pathogens, use appropriate disinfecting agents, and use proper hand washing techniques. Thanks for watching, and have a safe day.
Hi, I'm Emily, your safety trainer, and in today's video, we'll be talking about blood-borne pathogens. Blood is incredibly important for our bodies, keeping us functioning and healthy every day. Unfortunately, blood-borne pathogens can put others at risk when we are injured or if someone works with blood in their job. We need to be aware of these dangers, as well as what industries have higher than normal exposure risk to these pathogens, how exposure occurs, the personal protective equipment that should be used, and any safe work practices related to them. Through this lesson, we will gain a better understanding of how to prevent any potential harm that can come from blood-borne pathogens. Blood-borne pathogens are microorganisms that can cause serious and sometimes even fatal illnesses. Types of diseases caused by blood-borne pathogens include human immunodeficiency virus, HIV, which leads to HIV/AIDS, hepatitis B virus, HBV, hepatitis C virus, HCV, Ebola, malaria, syphilis, and brucellosis. Understanding how each of these infections is contracted and spread is incredibly important in order to ensure the safety of those who may come into contact with them. Want to learn more about hepatitis B, Ebola, or malaria? Check out our hepatitis B, Ebola, or malaria lesson. Taking preventative measures, such as wearing protective clothing, is one way to minimize potential exposure to these frequently dangerous infections. OPIM is a term used to encompass a wide range of materials, which could be potentially infectious if not handled with the appropriate safety protocols in place. It includes, but is not limited to, bodily fluids such as semen, vaginal secretions, cerebrospinal fluid, brain fluid, synovial fluid, fluid between the joints, pleural fluid, fluid in the membrane of the lungs, pericardial fluid, fluid in the abdominal cavity, and amniotic fluid, fluid that surrounds unborn babies during pregnancy. It can also include saliva and other body fluids contaminated with blood. In some cases, it may be difficult or impossible to differentiate between types of bodily fluids, such as during emergency response situations. Many other potentially infectious materials, OPIM, have the potential to spread such diseases, such as HIV, HBV, or HCV. Such OPIM includes unfixed tissue or organs from a living or dead person, cultures from humans and/or experimental animals, and certain solutions like cultural mediums. People who handle OPIM must take extra precaution to ensure their own safety by following proper safety instructions. Working in certain industries carries an inherent risk of exposure to blood-borne pathogens, posing a potential hazard to employees in these fields. Healthcare professionals, dental workers, and laboratory staff are among those at highest risk for injury involving blood. Further, increased safety precautions should be taken by first responders and emergency response personnel who may need to provide first aid as part of their job responsibility. In addition, law enforcement officers, firefighters, child care providers, janitorial staff, and maintenance workers must take special precautions to protect themselves from such injuries. This also applies to those performing housekeeping duties or working in waste management. Even those providing body piercing and tattoo services require the utmost caution when it comes to blood-related injuries. Taking additional measures can help minimize the risk that they may encounter while on the job. Since blood-borne pathogens can travel through both sharps and bodily fluids, there are many potential ways to be exposed. Sharps exposure is a major risk that you should consider. It's important to handle needles and other sharp materials responsibly, since they pose a threat if mishandled. Some examples of accidental exposure include needle sticks or getting cut with broken glass containing traces of blood. It's essential to remember that sharing needles can also be an exposure route. For more information on sharps, please check out our sharps injury prevention lesson. Additionally, contact with the infected blood or body fluid of another person can lead to contamination. This includes getting blood splashed into the eyes, mouth, nose, ears, or open wound. Exposure to these pathogens can also occur through contact with an infected person's blood or body fluids, sexual contact, injuries from an assault, or even inhaling particles from an infected person coughing or sneezing. While the risks of transmission by inhaling droplets is often exaggerated in the media, medical professionals consider this a rare form of exposure. However, diseases such as the influenza, colds, and even COVID-19 are known to spread in this manner. Personal protective equipment, PPE, is essential for reducing the risk of exposure to blood or other potentially infectious materials in the workplace. PPE includes safety glasses or goggles, face masks, face shields, gloves, disposable vinyl, latex, or nitrile are recommended, gowns, aprons, or smocks, and foot coverings. It's important to always inspect any provided PPE for wear or damage before use and report damaged pieces to your supervisor. Never use damaged equipment. If you're helping someone with a bleeding injury or cleaning up biological matter, such as spilled bodily fluids, always be sure to use responsible practices alongside proper PPE to minimize contagion and ensure the safety of everyone involved. While exposure to bloodborne pathogens may not be entirely eliminated in your workplace due to the potential for injuries to occur, there are things that you can do to minimize your exposure to bloodborne pathogens while at work. When encountering blood or other potentially infectious materials at the workplace, you should do the following. Where applicable, read and become familiar with your company's bloodborne pathogens program. If you have any questions about your company's bloodborne pathogens program, please speak with your supervisor. Make sure that all cuts, abrasions, or open wounds are properly covered. Speak with your medical provider if you have questions regarding the hepatitis B vaccine. If your company has a bloodborne pathogens program, the hepatitis B vaccine should be offered as part of the program. If you have questions about the hepatitis B vaccine in regard to your company's bloodborne pathogens program, please speak with your supervisor. Make sure that you are wearing the appropriate personal protective equipment for any task that involves blood or OPIMs. This includes donning PPE before providing first aid to injured individuals. Always treat blood and OPIMs as though they are infectious. Follow all your company's policies and procedures for work tasks that involve handling blood or exposure to blood and/or OPIM. Practice proper hand hygiene, especially after handling blood or OPIMs. Hands should be washed with soap and water for a minimum of 20 seconds. Handle all sharps and/or sharp-edged tools in accordance with the manufacturer's instructions and your company's policies and procedures. Do not share or reuse needles. Dispose of all sharps in designated sharp containers. Store all sharp-edged tools in accordance with the manufacturer's instructions and your company's policies and procedures. Do not eat, drink, smoke, apply cosmetics, including lip balm, or handle contacts in areas where blood or OPIMs are being handled or in areas that are contaminated. Clean up all spilled blood or OPIMs in accordance with your company's policies and procedures. Many companies tend to use bloodborne pathogens and/or body fluid spill kits for spilled blood or OPIMs. Make sure that all contaminated surfaces are properly disinfected in accordance with your company's policies and procedures. For more information on bloodborne pathogen spill kits, please refer to our lesson entitled Bloodborne Pathogens Spill Kits. Dispose of bloodborne pathogen contaminated material in accordance with your company's regulated waste policies and procedures. For more information on handling regulated waste, please refer to our Handling Biohazardous Waste lesson. If you have the misfortune of coming into contact with potential infectious material, such as blood, it's important to remain calm and take the necessary precautions. If there wasn't an area with a cut or you were stuck by a needle, make sure to wash the area with soap and water. In cases where there was a splash involved that involved contact with the nose, mouth, or skin, flush the area with clean water as soon as possible. Furthermore, if contact was made with your eyes, clear out your eyes thoroughly using water or saline solution. Remember to also report the exposure to your supervisor right away, though if medical attention is needed first due to serious injuries due to any puncture or cuts, then seek medical help first. Make sure to seek a medical evaluation from a qualified healthcare professional, as post-exposure treatment may be recommended and should be started as soon as possible. Assure that all exposure reports or other related paperwork are filled out in accordance with your company's policies and procedures. It's important to understand that exposure to bloodborne pathogens or other potentially infectious material can occur in any workplace. While some industries may carry higher risk than others, there are steps that can be taken to minimize the chances of exposure. We recommend you always use the appropriate personal protective equipment for your work tasks and abide by your company's policies and procedures for bloodborne pathogens. If you have any questions about exposure risks or policies in place, please don't hesitate to speak to your supervisor at any time. Being well informed of safety measures and potential risks is the only way to ensure you stay safe at work. That's all for today's lesson. If you like this video, look for us on social media, and remember, stay safe out there.